everyone, thanks for joining us today. My name is Kevin and I'm the clinical director of our Spear Cobble Hill location. Today we're going to talk a little bit about something that's been a little bit more of an issue over the last couple of years, especially with staying at home. We're going to talk about posture when working at your desk. Now, posture when working at your desk becomes a relevant discussion because there are honestly a lot of common complaints that come out of this particular activity. For example, we've worked with patients recently who complain of upper back and neck discomfort, as well as headaches, including a lower back pain, wrist pain, and tightness in their hips. These are just a couple of the different symptoms that could come from having poor posture when working at your desk. One of the first considerations when talking about posture when working at home is that your environment really does matter. Working at a sofa or on a bed would be the worst places because they don't provide you the support that we really require in order to maintain good posture throughout the day. Other components that will actually help your posture would be using a keyboard and a mouse, along with your desktop monitor that will help you keep your posture a little bit straighter because you can view your work at eye level. In addition to that, using a chair with a little bit of back support such that you can sit back fully straight and maintain an upright spine will keep you in a little bit of better alignment that'll help you to relieve any aches and pains that come up throughout the day. By far though, the most important thing for working at home is to maintain a certain level of activity. This can come up in certain different ways. One of the best ways is to set a timer for every 30 to 60 minutes to remind yourself to get up and walk around so you kind of get out of that resting posture that you have working at your desk. Activity like this helps you to increase a little bit of blood flow and mobilize your muscles for returning to work afterwards. When talking about proper posture, it's helpful to consider different positions from your feet up to the top of your head. So sitting in a proper chair will mean that your feet are directly on the floor, flat and fully supported, with your knees at 90 degrees sticking out directly from your hips. Your hips will be pushed back into the lumbar support of your chair, with your lower back straight and you contracting your core a little bit by pulling your belly button in towards your spine. This puts you in a better position in terms of your spine to start with. We would then take your middle back, your rib cage, and kind of stack that over your hips so we are upright in that position as well. When we move up from there, we talk about the shoulders. Your shoulders should be slightly retracted backwards so that you're not slouched forwards working towards your laptop. From there, your head should be placed over your sternum or your chest bone, and then your chin should be slightly tucked instead of sticking forwards towards your laptop. In terms of your arms, we want to rest your arms at 90 degrees on the surface directly in front of you so that it is the easiest and most ergonomic to reach your keyboard. When we're talking about relevant physical therapy exercises, we have a set of postural exercises and a set of strength exercises. Now, incorporating these into your daily and weekly routine will help to reduce some of the issues that arise with sitting at home working. The first exercise we have here is called the cat-cow. This one is helpful for improving flexibility in your lower back and middle back, which are common areas of pain when sitting at a work-from-home desk for long periods. The first thing you want to do for this exercise is to grab a yoga mat so it's a little bit more comfortable, and then position yourself on your hands and knees. Your hands should be directly underneath your shoulders and your knees should be directly underneath your hips. The first part of the movement is to round your back as much as you can, holding for a second, and the second part of the movement is to arch your back as much as you can, holding for a second. When performing this exercise, it'll be great to do it for 2 to 3 sets of 10 repetitions per day. This next exercise we have is a hip flexor stretch, which helps to improve flexibility in your hip flexors that get really tight when you sit for long periods of time. In order to perform this, you want to first kneel down on one knee with both of your knees being at 90-degree angles. From there, you want to imagine that you are tucking your tailbone underneath you, which will put the hip flexors in a little bit more stretch. Then you lean forward a little bit to increase the stretch on the hip flexor, and you want to hold this for sets of 30 seconds or 3 times on each side. This next exercise is called the thoracic extension exercise. This will help to reduce the roundedness of your mid-back when you work at a desk for long periods of time where people are prone to slouching forwards. In order to perform this exercise, grab a chair with a mid-back height. The first thing that you should do is to sit back completely in the chair with the lower back flush against the back support. You want to interlace your fingers behind your head with your elbows close together, and then imagine that you are reaching your elbows up towards the ceiling as you bend backwards. You want to hold for a second and then relax slowly. To complete this daily, aim for 2 to 3 sets of 10 repetitions per day. Before we talk about the difference between good posture and bad posture, I think it's more relevant to actually talk about how you're feeling when you sit for certain longer periods of time working from home at a certain position or in a certain setup. If the posture that you're maintaining at home in your work setup causes you achiness or pain at specific joints, then it would be something to consult with a physical therapist in order to see what is improper and could be addressed. Bad posture is really only bad if it leads to stiffness or pain in certain joints. And if there's a certain setup that works well, it would be helpful to continue that. But when the posture that you're keeping at home, especially if you're working at home for long-hour days, cause any pain, then it would be necessary to address some of those symptoms from there. As a physical therapist myself, the most common conditions that I see that are related to poor posture would be pain in the neck and pain in the lower back. Both of these end up being trickier body parts to adjust because they are ones that must be used whenever we're working on the chair and working at a laptop. It would be helpful to consult with a physical therapist in order to fully diagnose and assess the things that are happening at these joints.